Hello everyone, welcome to fascia training for knee pain. Now knee pain is a common complaint that among adults and most often associated with general wear and tear from daily activities like walking, bending, walking up the staircase, standing and lifting. So the most common causes for knee pain are related to aging, injury or repeated stress on the knee joint. So the repeated stress are something like sprain and strain ligaments, cartilage tear, tendinitis, and arthritis. Now the common types of arthritis will be osteoarthritis, rheumatoid arthritis, and also gout. Please consult your physician to know your medical condition better before you start any exercise program. Now today's session is to help you to reduce the risk of injury and to prevent further injury, and this session also help you to reduce some pain at the joint area. So to do that, it is very important that one, you need to strengthen the muscles that is around the knee joint. Two, you need to stretch the muscles around the knee joint. Three, if you're overweight, you need to lose weight. Besides exercise, you also need to watch your diet closely. Four, you can actually do massage. So massage can be using a foam roller. You can see a sports masseuse. And five, change your exercise impact. We cannot be high intensity and high impact all the time. So work with your impact exercise, alternate your impact exercise, and also alternate your intensity exercises. Now impact, you might want to switch from a high impact exercise into a low impact activities. The low impact doesn't mean it's low intensity. Low impact can be high intensity as well if you work on a full range of motion. And last, please talk to your physician before you start any activities program. Okay, for today's session, we need a foam roller. If you doesn't have a foam roller, that's okay. You can actually use a mini roll. If you don't have a mini roll, you can use a water bottle to replace the mini roll. You need a massage ball. If you doesn't have a normal massage ball, you can actually use tennis ball. I usually prefer to use a donut ball for people who have a lot of pain to work on the muscles. If it doesn't have a peanut ball, you can use 2 tennis balls, and also you need a sock. Okay, how do you do it? You put 1 tennis ball into a sock, you tie a knot, and then you put the second ball into the sock and you tie another knot, and you will get a dual ball. And we also need a long towel for the exercise program, okay, for stretching, also for isometric contraction exercise. You need some foam, okay, something that is soft. You can roll a huge big towel and then support it right at the hip for the training program. Now if you have all this equipment ready, we can start the training now. So we work from the calf, okay, because your calf actually crosses above the knee joint. We will also work the hamstring because the hamstring muscles cross below the knee joint. We will be working your inner thigh muscle because the inner thigh cross below the knees, and we work a little bit of the glutes and also stretch the side of the muscle because your glute is actually connected to your ITB and also your tensor fascial latae, your TFL muscle also connect to your ITB, and your ITB band actually cross below the knee joint. So you can see how all these muscles work together to stabilize the joint, to move the joint as well. So let's start from your calf muscle. If you have a foam roller, gently just place the foam roller just at the Achilles tendon and you roll all the way up to the knee joint. Lift your body while you work on your calf. Now, if you have a lot of pain, you might find that this is too much for you. You can actually use a mini roll, sit with your knee bend so that your calf muscle is completely slack, and you actually roll all the way up in this way. Okay, so we're done with the calf. So make sure you roll it for 1 minute, at least 1 minute, and then you go to the hamstring, so you can use your foam roller. For the hamstring, again, you push your body weight up and you roll from the knee all the way up to the sit bone, and make sure you rotate. So again, for those people who have a lot of pain, so this may be too much for you, you can actually use your bottle or your mini roll. So you use the other leg and push your body weight up just a little bit. So you're still sitting down there, and you put some weight on the other leg while you roll, and that make it a little bit easier for you. And then usually wear a sock, because when the roll is lower, so your heel will be down the floor. So with a sock, that make it much easier for you to do the work. Okay. Now of course you can also use the dual ball and sit on your calf. Now when you work your calf, when you rock side to side, you work the calf because you're sitting on it. You also work your hamstring as well. So you're releasing your calf, you're releasing your hamstring. So you keep moving all the way up. So you work both calf and hamstring. Good. Now let's go to your inner thigh, your actiFITAsia. So in the sitting position, just bend your knee, use the mini roll on your bottom, and just roll all the way down. With the hip, and roll all the way down, just to your knee. Of course, you can also use the ball. In fact, the ball you feel more comfortable. Okay, so make sure you roll from the hip all the way up towards the knees area. The next one will be your glute muscle. I usually gently prefer to use the ball. All I need to do, so you're using a tennis ball, you sit on the tennis ball. So I just rock my body weight to the side, and I gently sit on the ball, and I rock and work the whole buttock muscle. Okay. So this is a very comfortable position. Okay, so roll every part of your muscles for 1 minute. Good. Next one will be your quadricep, seated position. Use your roller and just massage through your quadricep. Okay, so again, you can also use your foam roller, and I know that people generally doesn't like it if they have a lot of pain at the joint area, because it doesn't want to lift the body, so they have to work so hard on the thigh. So I usually, for people who have a lot of pain, I usually ask people to use a small little bottle or just a mini roll. So either you use your hand to roll, or you can actually flip around and you put the mini roll just on the top of the knee joint. So allow your body weight to do the job. So allow your body weight to do the job for you. So rest your body weight and let your legs sink all the way down to the floor. And I add knee flexion here. So when I bend my knee, the roller will just go up a little bit. So I do it for a few times, and I shift my body weight a little bit lower. So the roller will go up, and I do my knee flexion again. Okay, you don't have to flex all the way up, just a slight knee flexion. Okay, good. Now I'm gonna move down, and I move down again. So you keep going up, all the way up to the hip area for your quadricep muscle. Good. So we're done with the foam rolling. Next one will be your strengthening exercise. So we're gonna need a towel for the strengthening exercises. I'm doing isometric, so I'm gonna put the towel at the ball of my feet, and I'm gonna pull my toe towards the shin area. Now in this position here, I am going to push the towel away, but I'm trying to resist it. So make sure that you hold on to the towel tight, and you just press the towel for 10 seconds, and you relax, and then you do it for 10 seconds and relax, and repeat the third round for 10 seconds and you relax. So you work the gastrocnemius muscle. So 3 sets, 1 set, 10 seconds. So the next one will be your hamstring muscle. wear a sock for this exercise. So I'll be laying down on the floor. So I'm going to keep my both knee bent, and I'm going to push my hip up. Doesn't matter how high that you push your hip. So you push it up, and then the other leg, you're going to straighten your leg. Press your heel down to the floor hard, and you can feel the contraction of your calf and your hamstring. Now slide in towards your hip and relax. You can take a short break, and then you push it up. You slide out, press the heel down to the floor, and you drag your heel towards the buckle, and you relax again. You lift, slide, press the heel down to the floor, and you pull in and relax. I'm going to try one more. Okay, I'm going to push my leg away, press heel down to the floor, and then you drag in again. You can do it between 8 to 12 repetitions, or you want to do it up to 15 repetitions for that one set. Okay. Now, if you find that 8 repetitions is too much for you, you can actually regress it down to 4 reps, 5 reps, 6 reps, and gradually increase the number of repetitions, because your muscle will get better and get stronger every time when you train. Now, the next one will be your inner thigh muscle. You need a foam roller. If it doesn't have a foam roller, that's okay. You can use a thick, big pillow. Okay, so what I need you to do is put the foam roller or the pillow in between of your legs, and your hand is behind you. So use your hand to push your chest up so that you are in that neutral position. Now inhale, exhale, and squeeze the pillow or the foam roller hard for 10 seconds, and you release, and you press hard for 10 seconds, and you release, and you do it for 3 times. So each set will be 10 seconds, but what I want you to remember, when you do the squeeze, make sure you're not slouching. So I need you to keep your chest up when you do the exercise. So you should be in that neutral position when you're doing an exercise. Next will be your hip, your glute. You need a towel. What you need to do is tie your legs above your knee joint. So remember, if you have knee pain, even you're using a resistance band, the resistance band should be above the knee joint area. So the towel will be above the knee joint. So you're gonna have your feet down on the floor. You can hold on to it. Lift up your chest. Inhale, exhale, and push the hip out. Okay. Imagine you try to break the towel. So inhale, exhale, and push up for 10 seconds, and you relax, and then you push again for 10 seconds, release, and push. So again, 3 sets. 1 set, 10 seconds, and you can untie yourself. And this will actually work your gluteus muscle. Good. So next one will be your quadricep muscle, your containe muscle. Again, you can have a thick towel or a very thick, big pillow, or you can use the foam roller. So you're going to put your legs, okay, just below. Place the foam roller or pillow just at the bottom of your hamstring muscle. So I'm going to place your hand behind you. So again, I need you to keep your chest up. So what I need you to do is to press the foam. So press the leg down towards the foam roller. Imagine you want to crush the foam roller. Crush everything down towards the floor. So inhale, exhale, press down. Good. You can feel that your quadriceps are doing the job by pressing it down, and then you release, and then you press down again, and your quadriceps will be contracting, and you release. So every time you press down isometrically for 10 seconds, and then you relax. So every exercise is 10 seconds. Each set is 10 seconds, up to 3 sets. Of course, you can do 5 sets if you want to. Good, we're done with the strengthening. The last part will be your stretch. Okay, for those who are not flexible enough, you will not be able to reach and grab your toes, so that will be a little bit too tough for people who are not flexible. You can actually use a long towel. So again, you wrap it at the ball of your foot and pull your toes toward to your shin, and you add a bounce. Okay, so if I'm using hand, so I'm going to grab this part, the ball of my foot, and pull my toes toward to the shin. You feel the stretch of your calf, and I add a bounce. So I pull toward to my shin. I can turn my ankle toward to the side, back to the center, and over to the other side. Okay, you can do it for 1 minute, you can do it for 2 minutes, as long as you feel comfortable and you have no pain at all. Next one will be your hamstring. So I'm still in this position. All I have to do is sit up tall and I bring my stomach down to the calf area. Okay, so if you're flexible, of course, you can actually go really low, but if you can't, that's fine. So work at a range that you feel comfortable. So you get down to the end range and you add a small little bounce. Now, fascia, we do not bounce in one direction and we never stretch in one direction. You want to go by all angle. Okay, make sure you relax your ankle. Start easy. And then you turn your body over to the other side. So keep it dynamic when you do the fascia stretch. Now when you're ready, you can actually add your toes by doing point and flex with rotation. So that's why I say that wearing a sock is always very useful. Good, come back to the center. So 1 minute, 2 minutes, up to you, whichever that you feel comfortable. So from this angle here, I will move my leg out to the side. So I will have my inner thigh muscle. So chest up, and I'm going to bring my belly button to my heel, the heel in front of you. And I add a bounce, and I'm going to turn my body and over to the other side. And when you are ready, point and flex, point, flex, point, flex, point, flex, when you do the bounce. Okay, so 1 minute or 2 minutes, up to you again. So next one will be my glutes. Figure 4, so sit-up position. I'm going to cross my leg over and pull the bottom leg closer to my body. Both hands behind me. Not to slouch. Inhale, exhale, lift your chest up. So you want to push your chest up toward to the ceiling. For those who are a little bit more flexible, you can actually lift the toe. Okay, so your leg will come closer to your chest, and you can actually lift up your hands a little bit higher so that your body goes toward to the calf area. If you're not flexible, that's okay to drop your toes, okay to lower down your arm, just lift your chest up. So in this position here, I push my body towards the calf. And I'm going to move my hand by moving towards the side so I can turn my body when I do my figure 4 stretch. Other side. Good. So again, 1 minute, or maybe if you want to do 2 minutes, that's fine. Now the next one, your ITB. I usually use something to lift up the hip a little bit. So you can use a thick towel and roll it, or you can use a thick, big pillow if you want to. So if you go down sideways, so my hip is actually being lifted up, so my hip is much higher now. So when I extend my leg towards the side, when I relax, my leg will not be able to touch the floor. So what I need you to do, I need you to push your hip a little bit toward to the back, but not arching your lower back. So from here, I drop by adding a bounce. So you can feel the stretch right at the side, your TFL, your ITB as well. So the bouncing stretch, you can actually move your leg forward a little bit. Now I'm going to move my leg toward to the back. So I move backward. And I come forward. I come back to the midline. And then go all the way toward to the back. Okay, so again, you want to do it for 1 minute or 2 minutes. It's up to you. Okay, make sure you work the other side of your body as well. So good. Thank you for attending the session, and we're done with fascial training for knee pain for today. And I see you for next week. The next week's session is still related to knee pain, but we will do it in an upright position. Good. I'll see you again next week. Thank you. Bye bye.